at is the state of mental health among healthcare workers. There's a research that was conducted by the Aga Khan University, and this was done between the month of January 2021 and June 2022, that sought to highlight the state and the state of mental health and resilience of health workers in the country. So from their research, they found that 1 in 4 healthcare professionals exhibit signs of depression, and also it revealed that 2 in every 5 healthcare workers show symptoms of post-traumatic stress disorder, what is conventionally known as PTSD. And so this research basically brings to the front the state of healthcare workers, because more often than not, what we focus on, even the policies that we have as a country, they tend to focus on the patient, forgetting the healthcare professional whom we go to for healthcare services. So from their research, they found that some of the key drivers for mental health challenges include heavy workload, lack of resources, poor working condition, and these are some of the things that we've seen in the past that affected even health services in the country, where we saw even doctors going on strike, downing their tools for even over 100 days, nurses downing their tools, issues to do with human resource. So they're saying that there's need to include policies that promote well-being among this cadre of healthcare professionals. Remember that this was done across all the 47 counties, and nearly 4,000 midwives and nurses took part in this study, where they were interviewed, and from it they found out that they were depressed. Like 1 in 4 of them were depressed. So what this research seeks to do is just to bring to the front the issues that are affecting these cadre of professionals in the country, and what needs to be done to just ensure that even as they discharge their services, their state of their mental health status is catered for, not forgetting even the policies that we come up with. Remember that even just the other day, President Uhuru Kenyatta assented to a mental health bill that was proposed by nominated Senator Sylvia Kasanga, that seeks to give power to mental health patients, where we find that they've given power to even the chiefs and police officers to just take over mental health patients who are neglected by the family, because mental health does not just affect the healthcare providers, but also we see patients across the country, and it's not just something that's affecting Kenya. It's a global health concern. And as of 2020, we saw some task force that was formed that was urging President Uhuru Kenyatta to declare it a national disaster, because most people were exhibiting symptoms of mental health condition, and that has been compounded even with the ongoing pandemic, the COVID-19 pandemic, that left thousands of people jobless, when now the economic impact left other people jobless and forced most people to be laid off just for businesses to thrive. So it is a matter of concern in the country, and now what researchers are noting is that we have neglected a group of people who also suffer mental health conditions. Deba.
Indeed, and we may remember that was in 2020, also the chair of a task force on mental health, that is Dr. Frank Njenga, had asked the government to declare mental health here in the country national disaster. A raft of issues also were raised there from the task force with their report that we should also be having a commission that can actually also be gauging and looking